You're in the shower or looking in the mirror, and you notice something, a bump. Maybe it's small, maybe there's more than one. Is it normal? Is it dangerous? Let's talk about what those bumps might mean, and when to see a doctor. Hey, I'm Dr. Zoe Hartley, and this channel is all about clear, judgment-free health info for men over 50. We're not here to scare you. We're here to explain what's going on with your body, simply and honestly. Today, penile bumps. Let's break it down. Let's start with bumps that are completely normal. 1. Fordyce spots. Small white or yellowish spots, often on the shaft or scrotum. Completely harmless sebaceous, oil glands. Not contagious, not an STD. 2. Pearly penile papules. Tiny dome-shaped bumps around the edge of the glands, head of the penis. Normal anatomical variation, not a disease. Most common in younger men but can appear anytime. 3. Skin tags or cysts. Small soft growths or blocked pores. Usually painless and benign. Can grow with age, weight changes, or friction. Now, some bumps might need medical attention. Here's what to watch out for. 1. Genital warts HPV. Flesh-colored or gray bumps, often in clusters. Caused by human papillomavirus, HPV. Can spread through sexual contact. Often painless but may grow or itch. 2. Herpes HSV. Small painful blisters that turn into open sores. Often comes with burning or tingling. First outbreak is usually the worst. A sexually transmitted virus that stays in your body. 3. Molluscum contagiosum. Smooth, round, skin-colored bumps with a dimple in the center. Viral and contagious. May go away on its own or require treatment. 4. Syphilis chancre. A firm, painless sore that appears during early syphilis. Needs immediate medical attention and antibiotics. Here's the bottom line. See a doctor if the bump changes in size, color, or shape. It's painful, itchy, or bleeding. You have multiple new bumps or open sores. You're sexually active with new partners. You don't have to diagnose it yourself. That's what doctors are for. And yes, they've seen it all before. If the bump is harmless and confirmed by your doctor, here's how to care for the area. Keep the area clean and dry. Avoid popping or picking at any bumps. Use gentle, unscented soaps. Wear breathable underwear. For prevention, practice safer sex. Get regular checkups if you're sexually active. Consider the HPV vaccine if you're eligible. It's not just for teens. Having a bump doesn't mean something's wrong with you. In fact, most bumps on the penis are harmless. But it's smart and strong to get it checked out if you're unsure. Don't let fear or shame get in the way of your health. Was this helpful? Hit like and subscribe for more straight-up talk about men's health after 50. And if you're dealing with irritation or redness, watch our next video. How should I clean my penis? No shame, just real answers.